Hello there. My name is Marilyn from Maya Health Wellness. I'm a healthcare provider working in an outpatient clinic. In this channel, we're going to look at some of the factors that promote well-being and look at some of the things that we go through as a healthcare provider. In my previous video, I promised that we're going to look at some of the things that we need to do as parent and carer whenever you have a sick child. Before we could begin, for those who are joining us for the first time, karibuni sana. For my returning subscriber, thank you. Don't forget to like, subscribe, hit the notification bell, share, and let's learn together. Our today's topic is fever in children. Fever is defined by most healthcare providers as a temperature above 38 degrees Celsius and higher when taken rectally. The organs involved in helping the temperature regulations include one, we have the brain, the skin, muscles, and blood vessels. Okay, so body responds to changes in the temperature by one, increasing or decreasing sweat production. Number two, involving or even moving blood away from or closer to the surface of the skin. And number three, getting rid of or holding on water into the body. And then number four, we also have seeking a cooler or a warmer environment. So some of those are the response that the body needs to do in order to regulate body temperature. So when a child has a fever, the body works in the same way to control the temperature, either one to increase or to decrease the body temperature. Some of the causes for fever, one, we have infectious diseases. Some of those infectious diseases could either be under viral or bacterial. Under viral, we have some of these infections, like, of course, one, we have H. influenza virus. We also have adenovirus that are very common for causing high fever in children. Examples of those bacterial infections that normally cause high fever in small children are one, we have pneumonia. Of course, also we have other parasitic infections that also causes fever. There are certain drugs that can also cause fever, which we have antibiotic, we have seizure drugs, and also we have hypertensive medication that can also cause fever. And also we have heat stroke or heat exhaustion. Okay, we also have injury and inflammatory process that can also cause fever. Under those inflammatory processes, we have rheumatoid arthritis as a very common causes that cause fever in small children. And then we also have cancerized. Recently, we have malignant tumors are some of the causes that can brings about fever in small children. Now we have some of the symptoms that associates with fever. One of these, we have sweating, chills, shivering. We have headache in older children. We have muscle ache. Also, these ones you can evaluate in older children. We have loss of appetite, irritability, dehydration. We have general body weakness, cough are some of the symptoms that associates with fever. What do you need to do as a parent, or when is it the right time for you either want to call a healthcare provider or when to seek a healthcare provider services? Number one, when you have a child who is less than 3 months old, okay, and has a body temperature of about 38 degrees Celsius, then those are the indications that you need to seek a healthcare provider. Number two, we also have repeated fever, whereby a child has fever that keeps on coming and going. So that one, again, you need to do what? You need to seek a healthcare provider. Number two, we have listlessness or confusion. Also, we have a child that has poor eye contact. If at all one you call this child, they're not able to respond by either one look at you, or number one, they even respond to those particular calls. So some of those are the alarming signs that you need to take this child to be evaluated for the causes of fever. And then another thing that you can also have is vomiting repeatedly, or has severe headache, because we look at some of the symptoms and we agree that fever does not come alone. It's not a standalone symptom. So there are other associating symptoms that we have mentioned above, like a good examples are those like cough, we have headache, chills, and shivering. So now if a child has vomiting, which is repeatedly, or has severe headache, severe sore throat, stomach ache, then this is a child that needs to be seen by a healthcare provider. And then lastly, a child who has a fever that lasts more than 3 days. Okay, so this child has a constant fever, and this fever has lasted for more than 3 days. Then this is a child that needs to be seen by a healthcare provider. Now we have some of the complications of a fever. One of the most of those complications of fever is shiver, or we have convulsions. A child that starts to develop convulsions. When we talk about convulsions, these are involved the movement of the body, or shaking of the body. The child can either be unconscious or shaking generalized body. So we have hands and we have feet, and of course you have the eyes that are rolling back, or we have stiffness of the body. So some of those are the signs for convulsions that children develop whenever they have fever. So now, what do we need to do as parents? Now that I have a sick child, I have a child who has fever. This child has other symptoms. For instance, the child has cough. This child has developed difficulty in breathing, shortness of breath. What do I need to do as a parent or a carer? One, for instance, if this child has this fever of more than 38 degrees Celsius, then of course we do antipyretic. One of those antipyretic, we have paracetamol. The doses depend again with the age and the kgs, body weight of these particular children. So you measure by the body weight. So you can either do paracetamol, you can also do ibuprofen, in order just to take care of the fever and let the child be seen by a healthcare provider. But of course, there are those fever that are self-limiting, that does not need medication. But of course, if the child has the above symptoms that we have also mentioned there, then those are some of the warranting signs that this child needs to be seen by a healthcare provider. So now, when we talk about complications that comes about with fever, and we have mentioned seizures or even convulsions, whereby the child has general body movement. We have neck stiffness, we have rolling of the eyes, and of course we also talk about unconsciousness. So now, during the time that this child is convulsing, just put the child on a flat surface, move any object that can injure this child, let this child sit until that episode of convulsion stops, and immediately rush this child to the nearest health facility. So always remember to stay calm. Don't panic whenever that you have a sick child, that you're feeling that this child is worsening, and of course are having convulsions, because when you panic, you're not being able to find the best way on how to assist these children. So the use of antibiotic in children at home is what I'm trying to discourage, and that is what I'm saying, that whenever we have these children, if we're seeing these symptoms, and fever is one of the most common things that make us start to think of putting these children on these antibiotics. So first, just do the antibiotic, let this child be seen by a healthcare provider, necessary lab tests to be carried out, so that once you find out and get to know what exactly this child is suffering from, then the correct medication will be started on this particular channel. Thank you so much for listening to me. Leave me a comment. Tell me your experience whenever you have a sick child, what you usually do, and of course, what do you think that we need to do as a healthcare provider to assist you do the best by attending to this sick child. Of course, don't forget to do what? Don't forget to subscribe, share. Ciao. See you next time.